Hey everyone, so I wanted to do a lecture on Chapter 6, which is medical malpractice and other lawsuits. Again, I think you'll get a lot out of this. I know that it sounds boring, but it's actually quite interesting and something that happens quite a bit in healthcare. I'm not going to go over the chapter objectives, but feel free to take a look at those at your leisure. So practicing medicine, of course, there's statutory guidelines to make sure that you're held in a professional standing, right, depending on what your level of care is. So statutory guidelines, just so you're aware, are legislative laws defining legal rights and responsibilities. And when we talk about this, we're talking about caregivers. So from that perspective, there are rules in place to make sure that you're practicing medicine in a way that's standard and ethical. So the two differences that we really want to talk about more than anything else is negligence and malpractice. So negligence is failing to act in a reasonable and prudent way, and malpractice is a lawsuit that alleges misconduct of the professional. So most of the time in a medical malpractice case, as this mentions, you have to have an expert witness. There has to be someone that says, from the perspective of maybe you're a doctor, another doctor has to say this wasn't the standard of care, so that would, of course, that's why maybe it resulted in harm to a patient and became a malpractice lawsuit. But negligence is a little different. A malpractice can be negligence, and negligence can be malpractice, but there are some differences. Negligence alleges that a defendant did not act accordingly with like a reasonable person would in that situation. So malpractice alleges that misconduct of the professional implies greater duty of care to the injured person. So one's saying you didn't act in a reasonable manner, and the other is saying that you didn't follow your professional duty or your professional guidelines in order to give appropriate care to patients. Now, it can get a little confusing. They're very similar, so make sure you know the differences there. Here's some of the elements of a medical malpractice lawsuit. There has to be a provider and patient relationship. The relationship has to be established from the perspective of duty owed by the healthcare provider to the patient. The duty of the patient had not been upheld at a professional standard of care like we talked about before. They didn't act in the standard of care. And then healthcare provider had to breach duty to the patient. Sometimes it results in an injury. Yes, that's kind of the next phase here. And something that's really important, the healthcare provider's breach was the proximate cause of the patient's injury. So this means that from the perspective of maybe the provider didn't give adequate care, but it didn't result in injury, then of course that really wouldn't relate to a medical malpractice lawsuit. Maybe the right care wasn't given and the patient had a car accident later, but it wasn't a result of the care. Then that really wouldn't be, something that falls on the provider as a medical malpractice lawsuit. Now, you can get into details, and maybe it did. I'm not going into exact terminology here, but I'm just saying from the perspective of a medical malpractice lawsuit, it needs to have proximate cause. All right. Some knowledge check here. You can take a look at that when you have time. But let's talk about duty a little bit. There is a duty between the patient and provider relationship to deliver care in an effective and reasonable manner, right? That standard of care that we talked about. But there has to be an offer. So the provider has to offer to give care to the patient. The patient has to accept, and there has to be mutual agreement. A provider doesn't have to see a patient unless the patient shows up to the ED. Of course, there's rules regarding that. EMTALA is a rule. In the ED, you have to be triaged and have a medical screening exam. But I'm talking about, let's just give an example of a primary care provider. A primary care provider does not have to see a patient if they're not in a mutual agreement and they're not good fits. You can actually dismiss a patient from your practice. So that happens at times. So there has to be an offer, acceptance, and mutual agreement. And that's the part of the duty of the process. We already really talked about standard of care, but it's defined as a reasonable degree of care which a patient receives from a healthcare professional. This is why medical school and making sure you're keeping up with your education is so important, especially on the clinical side of things. The standard of care can change over time. The care that you're delivering now is probably a lot different than it was 20 to 30 years ago because there's new standards and there's new research. So when caregivers at times ask me about standard of care, I always remind them to keep up with your skills because the standard of care does change, and we need to make sure that we adapt in order to treat patients in the right way. So keep that in mind. Injury and causation. Injury is to sue for malpractice. The patient must have an injury. We mentioned that. Without an injury, there's really not a cause to sue, and there's no case. Causation means, causation usually means it has to happen, like we mentioned earlier, proximate, because of the provider's delivery of care. And there's two things here: but-for causation and proximate cause. For but-for causation must be established. I'm trying to think of a good definition. Let me get you something that is less confusing than this and that explains it a little bit better. The textbook. So but-for means it looks at the cause and effect ratio between the provider and the injury, or the person that is getting sued in the injury. So you can take a look at that, of course, in the chapter 6. It's a little confusing, but I'm going to get you the page number here, 140, and what I'm reading is but-for is the action of the healthcare provider and the injury. So it says this means that but-for the action of the healthcare provider and the injury would not have occurred if there was not proximate cause between the action the provider took and the patient's injury. So it's a test that's done. So you can take a look at that. It's got some cases in here in chapter 6 that are really, really interesting. So take a look at that when you get a minute. It's kind of confusing, right? So these are legal terms, but we'll work with you here. It's not going to be super confusing on the test. I'm not even sure if that's mentioned on the test, but it's something that you need to make sure you're aware of, at least. This is an easier thing, informed consent. Many of you probably already know this, but it's a process of communication between the patient and the healthcare provider that leads to an agreement between the two parties, right? A lot of times you have to sign an informed consent agreement when you walk into a clinic or an office or a hospital in order to get treatment. So that's just one example. So the healthcare professional informed consent, there's usually policies about this in healthcare settings, but you need to make sure that you have an awareness of the implications of informed consent. This says medical assistance cannot be delegated to obtain informed consent from the patient. There's certain rules and regulations depending on feds in the state that you need to be aware of here. I'm not going to dig into those, but I really want you to know there has to be informed consent prior to treatment. So the patient has to consent to treatment unless they show up unconscious in an ED, something from that relation that a Good Samaritan law would take care of the provider. I know Good Samaritan laws are also discussed in this chapter. So impact and defense mechanisms, a little bit different. Medical malpractice lawsuits are often traumatic, right, for the healthcare provider. The negative emotions of the healthcare provider may fester, right, over time. During litigation, might cause some issues. So that's what impact is. And defense mechanisms are ways to, of course, protect yourself in relation to a lawsuit. And we're not going to dig into that, but just some terms here. Negative defense in economics and medical malpractice. Read negative defense in your textbook, but I want to talk about the economics of medical malpractice. It is one of the reasons why healthcare is so expensive. It's defensive medicine, right? And it also can lead to reasons why providers don't try risky procedures. And this can be a complication when patients are going through life-threatening illnesses. So there are some negative consequences to medical malpractice lawsuits out there, and it is a cycle that we really need to figure out a way to overcome. I definitely agree that patients should be able to hold providers accountable for their care if they don't act in a standard of care, but it does increase the cost of healthcare nationwide. So some problems, right? From the relation of a medical malpractice lawsuit, you can take a look at this example, but it gives you some great information here about the medical malpractice process. All right, risk management and empathy. I'll highlight these really quick. In hospitals and healthcare organizations, there's usually a risk management team that helps with risk issues, and this is not just right medical malpractice issues, but also risks in the hospital setting, right? Compliance education, certain things like that. So if organizations are ahead of the game and make sure that their caregivers understand, what you can and you can't do in a healthcare setting, that's usually a better thing in relation to risk, right? So risk management really helps get in front of things, so it's not always a negative. And then when providers run into situations where they might have to make a decision, they're weighing the pros and cons. Lack of empathy, you do see this at times. Especially during COVID, there was a lot of burnout. I think empathy was there, but also people were running into issues where they had been on call for many hours out of the day or many days out of the week, and there's exhaustion and burnout could build up, like we talk about in risk management here. But empathy is a form of communication that's it's a deeper understanding, as this says. So we need to make sure that we have empathy, and empathy is one of the reasons why I think medical malpractice has increased over the years. If we get that back, hopefully over time, we can limit the amount of issues that are happening and really understand that most providers are coming at things from a positive place. All right, this is going to talk about defense of medical malpractice. I'm not going to go into this because I know there's 2 lectures that you've had, so take a look at this when you get a chance. I do want to mention the statute of limitations. So there's laws out there that sets a time limit on which one person can sue someone else. So from that perspective, if you had a procedure that was done 20 years ago and you're having complications for it, there could be a statute of limitations that says medical malpractice. It's only 2 years, so you can only go back 2 years. And I think that's really important in a safety mechanism for providers, right? So statute of limitations. That is a test question, by the way. All right. Another form of negligence you can take a look at as well. So feel free to take a look at that. Not something that's going to be a test question. All right, guys. Let's highlight really quick. There's a couple of different things that I want to look at. Emergency situations. We talked about the Good Samaritan law. That's really important. It does protect healthcare providers in relation to if someone shows up unconscious, they're going to deliver care to that person whether or not they consent, right? The Good Samaritan law protects healthcare providers in that relationship from a provider and patient perspective. So that is something that's a test question, and that's something that's important, right? Because emergency rooms have this, and that's why they're there. So this is a common law thing that was brought over from Europe. The relationship duty, training, breach of duty, injury, all those types of things that you normally see in a medical malpractice lawsuit. Standard of care is really still going to be there, but there's an extra layer of protection because you're not able to get informed consent in that environment. So feel free to take a look at the rest of the slides. I don't find them as important, and that's one of the reasons I went through this a little quicker. But there's some great information in this chapter. Make sure you read over it. And there are some test questions as we highlighted. But if you have any questions for me, don't hesitate to reach out. It's a very interesting chapter. And of course, I'm looking forward to hearing your thoughts about it. Reach out if you have any questions. Thanks so much.